On, let's talk a little bit about headaches, because that's a very, very common problem. You know, people sleep wrong, they wake up with a headache. Sometimes people don't sleep well, they wake up with a headache, or they have trouble breathing at night when they go to bed, and so they are deprived of oxygen during that sleep mode, and they wake up with a headache. So there are different kinds of headaches. So we have migraines. And if you're dealing with migraines, the number one thing you have to do is no gluten. No grain. Also no dairy. It's a major migraine trigger. No MSG. Okay, so you really got to watch the diet. These are three of the biggest triggers that we'll see people have with migraine headaches. Now, if you don't have a migraine, let's say you have a tension headache, and those are a little bit different. These generally are in the muscle. They start kind of the base of the head and the occiput, and they can wrap around the head as well. But the tension headaches, a lot of times what will clean up a tension headache very easily is magnesium. And anywhere from 400 to 600 milligrams of magnesium can be very, very helpful to relax the muscles, to give some relief. So magnesium for a tension headache. The other thing is light stretching. Now on our website, we have some videos of some different neck stretches that you can do. And so those can be very, very powerful. One of my favorite is just a simple stretch called the smelly armpit stretch, where you take your nose into your armpit. Again, smelly armpit, so nose to armpit, and you reach your hand around the back of the head and you just lightly stretch and pull the neck down. And you'll get a stretch all through the base and the back of the neck muscles. And you can turn your head left or right in that stretched position, and you'll notice that there's a change in the muscles that you're stretching. So that stretch can be very, very effective at relieving the tension in the spine, along the back of the head and the occiput muscles. And so stretching can be very effective. Magnesium can be very effective. One of the things that also works really well if you have a deep bathtub is a magnesium or an Epsom salt bath, where you can dip your neck all the way down to the base of your skull, just kind of slide down into that bathtub. The magnesium actually from the salts can absorb into your skin and really relax the muscle, but that heat can also really help with the tension and relax the muscle as well. So headaches, migraines, you got to look at your diet, because migraines they're always triggered by something. They're triggered by something you're doing or something you're eating, but these are the three top food-based triggers. And then tension headaches, again, that magnesium can be very effective. Stretching can also be very effective. Nice, warm, hot wraps can be very, very effective. But ultimately, if you have repetitive tension headaches, one of the things that you want to think about is changing your pillow, especially if it happens in the morning when you wake up. One of the other things that you want to think about is, do you have muscular imbalance or muscle weakness in the neck as a result of what you do for a living? So again, we live in a society where everybody's computer oriented, so the whole world is hunched over a keyboard all day long. And what that does is it creates muscular imbalance in the spinal postural muscles, and so it can tend to lead to, that imbalance can tend to lead to repetitive tension headaches. And so for some people, again, it's changing the positioning at work, right? What do you do at work? Well, you take more frequent rest breaks, you do more intermittent stretching in between that computer time. Those are things that are very important to do, lest you keep struggling. Okay, let's talk about joint pain. A lot of people do joint replacement surgeries every year. It's one of the more common types of surgeries, knee replacements specifically. A lot of people have shoulder impingement problems, shoulder joint pain problems, elbow, wrists. You know, we're talking about a major, major catastrophe in our country. And most people's joint pain, just like we talked about with the back pain earlier, is caused by loss of strength around the joint itself. So loss of strength of the muscles around the joint. And so what happens is you get, when you have muscle atrophy, so in this case, if we look at this diagram, let's say this muscle's atrophied and is shrinking, and you see muscle attaches across the joint to the femur. Well, if this muscle's shrinking, what's it doing? It's pulling the head of that femur It's pulling up and it's pushing the head of that femur more into the acetabulum, more into the socket of that joint. And so you get compression, and that compression leads to more friction inside of the cartilage. And so you get, over time, you get a lot of joint pain. And this can happen too because there are bursa inside of some of your joints. And so when that muscle tightens up, it compresses that bursa, or that sac, that cushioning sac, and it can inflame it. And so then that joint becomes very, very painful. So stretching is one of the most important aspects to help with joint pain. But once you've stretched out the muscle, you really got to focus on strength, on strengthening the muscle. So stretch first, then work on strength, and then again work on being less sedentary. Now, some people will say, well, Dr. Osborne, I stretch regularly, I'm not weak, I still have joint pain. In that type of situation, we have to turn and look at what kind of joint pain is it, because a lot of joint pain is autoimmune in nature, and if it's autoimmune joint pain, then most likely you have a food trigger. And so you got to get food allergy, food sensitivity tested, because if you don't change your diet, the diet trigger itself will perpetuate the pain indefinitely. And so you've got to figure that part out if you're already doing these things. Now, one of the other aspects to chronic joint pain that I think is important, that very important to mention, are some things that you can take. Because a lot of times if you've had an injury in a joint and there's been years of wear and tear on a joint, you need some backbone you need some nutrients to help repair and thicken and rebuild that cartilage, especially if it's cartilage erosion or if the joint pain is being caused by like bone spurs coming off the bone. And sometimes bone spurs can be very painful and refer pain into the joint. So what do we use? One of the best things that you can use is glucosamine chondroitin and MSM. So these things can be very, very helpful for a lot of people. This is actually one of the top selling supplements in the world because of this right here, because of the frequency and the chronicity of people having joint pain. So as a supplement, this is actually, in my opinion, one of the best combinations. Glucosamine chondroitin and MSM can be very, very effective, and they don't have any untoward or bad side effects. So, but again, by itself, just taking a bunch of these pills, you know, if you've got a sedentary component, if you've got a loss of strength component, not going to be the most effective way. You got to combine all of these things together to make sure you can overcome that. Okay, muscle pain. There's different kinds of muscle pain. We've talked about sprains and strains earlier. So, you know, if you strain a muscle because you've overworked it, we talked about the importance of vitamin C and quercetin and collagen and amino acids like glutamine and branched chain amino acids. But then there's also muscle pain that can be caused in many people as a result of muscle atrophy due to chronic inflammation. I see this a lot in people with autoimmune disease where they've had, it's usually muscle pain doesn't occur in a vacuum. It occurs with joint pain. It occurs with inflammation, systemic inflammation. And so people in this situation with chronic muscle pain, you know, diseases like fibromyalgia or just general myalgia, right? Reactive arthritis and some of the other conditions associated with this. Again, this goes back to diet change. And my recommendation is going to be like a broken record tonight: no grain, no pain diet for chronic muscle pain if it's not a traumatic injury. So you didn't strain a muscle from working it, but you just have chronic pain. This is one of the things that you really have to look out for is your diet. So again, the best home remedy in the world is something that you can eat differently, right? You can do that at home. It doesn't cost you any more money to not eat food triggers. But no grain, no pain. Again, following that, what is that? That's virtually, it's grain-free, it's dairy-free, it's sugar-free, it's chemical preservatives, processed additives-free, it's pesticide-free. It's a diet, you know, that removes for most people, the vast majority of their triggers. And again, if you follow that for 30 days, you get a lot of people experience tremendous relief. Now, if you've changed your diet, again, if you haven't experienced that relief, you want to check for food triggers, and this would be more where you'd follow up with your doctor. It's not home remedy style, but you'd follow up with your doctor and check for triggers. Specifically, you want to check for food triggers in this case, because food triggers are one of the most common cause of persistent muscle pain and aches. Okay, let's talk about nerve pain. This is a different animal altogether. Now, there's also different kinds of nerve pain. There's nerve pain, in this case, in this diagram, you can see this is an example of sciatica, which is what we would call compression. So the nerve itself is under compression. So if you've ever heard the term pinched nerve, right? That's what sciatica basically is. And you can have pinched nerve pain. There are a number of different varieties of examples of a pinched nerve leading to pain. One is sciatica. Another is basically brachial radiculopathies, where you have numbness, tingling, and pain traversing down the arm, whether it's left or right arm. And this can come, a lot of times this can come from a disc herniation. Sometimes it can come from a tight muscle. In the area here, you've got a muscle called the piriformis that can push down on the sciatic nerve, but in your neck, you've got muscles as well, and many of these muscles, as they get tighter, can compress that brachial plexus and put pressure on the nerve, creating a radiating pain. So again, these are forms of nerve pain. So if you have nerve pain as a result of physical muscle tightness, then obviously the answer is to figure out why that muscle's in spasm and then to kind of give it some relief. And so from a home relief perspective, that would be stretching, that would be heat compresses to loosen up the muscle. You would want to do things that would also relax the muscle and relax the nerve. And so with nerve pain, this is where we get into some of the beneficial therapeutic herbals. And so some of my favorite, chamomile. Some people do like a chamomile tea or chamomile as an herb. Valerian root can be very effective. Hops, very effective. Kava can be very effective. Even GABA. These are all basically things that will relax nerves, but also simultaneously relax muscles. Magnesium is also one on this list that we definitely would want to put, because it's very important for that muscle relaxation. A lot of times too, I'll see people with chronic nerve pain when they have calcium deficiency. And how do we know about that? We measure it. We measure to see whether or not they have it. But calcium deficiency sometimes is a trigger or cause of chronic nerve pain as well. And then additionally, one of the factors involved in nerve pain is high sugar, high blood sugar. Why? This is what we get. We get diabetic neuropathies because of high blood sugar, and the damage that high blood sugar does to the substances that flow through the bloodstream, and the damage that it does to the actual nerve itself. And so a lot of diabetics will have a neuropathy distally in their toes, in their feet, in their hands, and that numbness, tingling, and pins and needles type sensation can occur very aggressively. And so diabetic neuropathy, we got to change the diet. What do we want to change the diet to? Again, broken record, no grain, no pain diet. It's going to be low, no sugar, and it's going to be not low carb, but it's going to be equal carb. So it will not be an abundance of carbohydrate contributing to those elevations in blood sugar. But that's got to be something that you have to consider, because all of these herbs, these are temporaries, right? These are things to give you immediate relief, but they're not long-term solutions. Just like drugs don't bring about long-term solutions, neither do herbs. They're just temporary relief while doing less amount of damage as possible, right? Because a lot of the drugs have untoward side effects that you don't want, but a lot of these herbs have been being used for thousands of years and have these wonderful safety profiles where they generally don't tend to cause a lot of aggressive problems in people, but they can give some relief. And again, we're looking for immediate relief so that we can make long-term change, we can solve these types of problems. Other examples of nerve pain, so there's, the diabetic neuropathy, but you also have nerve entrapment syndrome, so again, sciatica, radiculopathy down the arm because of muscular tightness in the neck or a disc herniation in the neck. And then another very, very common one are what are called tunnel syndrome. So most of you have heard of carpal tunnel. It's that tunnel in the wrist here that can entrap the median nerve that goes into the hand, causing a lot of pain. And so a lot of doctors want to cut that tunnel, or they want to, or cut the sheath around that tunnel and open up to relieve people's pain. But one of the biggest reasons that that tunnel becomes compressed in the first place is inflammation. And with inflammation comes water retention. Vitamin B6 is one of Mother Nature's, it's a natural diuretic. And so a lot of people with carpal tunnel nerve pain end up doing really, really well taking vitamin B6. Now, you got to be careful. B6 is one of the very few vitamins of all the vitamins that can cause a side effect at too high of a dose. So you've got to be careful. My advice here would be, if you're looking at B6 and you're not monitoring it and you don't have anybody guiding you, I really probably wouldn't go higher, much higher than 50 milligrams a day without good guidance. But B6 can be very, very effective for a lot of people's nerve pain. Another type of nerve pain is called burning neuropathy in the feet, and we'll see this, and this can actually be a vitamin B5 deficiency. And so you might have a burning neuropathy in your feet that vitamin B5 could solve. We also get numbness and tingling in the feet, and that is very frequently a vitamin B12 deficiency. And so again, these are just simple things that you can take. We talked earlier about B-complex vitamins and how they work as an analgesic and how they work in effect to help reduce people's pain. And these are some of the reasons why. And again, in this regard, nerve pain. Now, one of my other favorite supplementals to use for nerve pain is alpha-lipoic acid. Alpha-lipoic acid can be very, very supportive of nerves to heal. And this is especially true if you have been diagnosed with diabetic neuropathy. There have actually been research studies where alpha-lipoic acid is used in diabetic neuropathy and patients experience great improvement. So just another example of a nutrient, a home remedy that something you can do at home that might have profound effects on your nerve pain. Okay. Wanted to point this article out on vitamin C, because vitamin C, of all the nutrients, is probably one of my favorite. You hear me talk about it a lot. It's one of my favorite because it has so many different functions. But clinically speaking, in my experience, one of its major functions is in reduction of pain. We use a lot of vitamin C in the practice on people who are dealing with chronic pain. And one of my favorite ways to use it is to combine it with quercetin, because they work synergistically together. So C plus quercetin equals a massive anti-inflammatory effect. And this effect is the same area in the cell that steroids will work on, but without the side effects. So again, one of my favorite. And this study just kind of is a summary of insights into using vitamin C for pain. But you can see here the prevalence of low vitamin C and vitamin C deficiency is high in various patient groups. This is true of surgical patients, trauma, infectious disease, as well as cancer patients. And you see a number of clinical studies show that vitamin C administration to patients with chronic regional pain syndrome. So if you ever heard of sympathetic dystrophy or reflex sympathetic dystrophy, also sometimes called chronic regional pain syndrome, vitamin C administration decreases their symptoms. People with acute herpetic, this herpes outbreak, so like the shingles that can occur in people that can be very, very painful. Research shows that type of nerve pain or neuralgia is diminished with high doses of vitamin C administration. So vitamin C works on muscle pain, it works on nerve pain, it has multiple different mechanisms of action. If you combine it with quercetin, it works, in my experience, even better. And that's why it's one of my favorite home remedies for pain, because it's super cheap and it's super widely available and it's easy to get access to. Okay, so let's kind of summarize up. There are a lot of things that you can do from a home remedy perspective. Over here, we've kind of summarized. You've got massage is one. So some of you are like, well, that's not a home remedy because that's a massage parlor. But one of my favorite massage tools are these massage guns, and you can pick these things up anywhere. They're a dime a dozen anymore, but they're the massage guns that have that high oscillating head, and you can put that into a belly of a muscle, and you can apply the pressure that feels the most comfortable for you. But massage is a very, very effective home remedy technique for pain. Epsom soaks, Epsom salt baths, electrolyte replenishment, magnesium and calcium, big on the list. A number of herbals, we mentioned passion flower, mentioned chamomile and valerian and kava, as well as stretching, light, and light movement. We'll also talk about light, but light movement. So movement to toleration. Again, if it's an acute injury, you want to give it a couple of days off. But once the acute nature is starting to move past, you want to start moving that joint, moving that muscle, that tendon, that ligament as much as you can, but lightly. Don't overdo it. That's light movement's very important for healing. Rest when necessary. And let's back up, because we should have really two bullets here. But light, one of the biggest healers is sunshine. And a lot of people, when they get injured, what do? They go inside and they close the doors and shut all the windows, and they don't get any of the exposure to the sunshine. But vitamin D can be very, very effective as a home remedy for a lot of different types of pain as well. We see this specifically with muscle pain. You remember, you need vitamin D for calcium and magnesium to move across cell membranes to contract and relax muscles, but also to stimulate the function of nerves. And so outside light, sunshine, can be very, very important part of your home remedy kit. Now, one of the things I didn't talk about, and I know maybe is on a lot of your minds, is the essential oils. I've got a special guest coming to the show here in a few weeks, and we're going to do an entire crash course on hacking essential oils for home remedy uses. So I've got that coming down the pipeline. But in summary, these are all things that you can do. They should be all things that you have at home. They're all free for the most part. I mean, supplements aren't free, but movement and Epsom salt baths, taking a hot bath, stretching, getting sunshine, those are things that, you know, are part of God's nature, God's medicine cabinet. And you should be tapping into them, because they're more powerful than any drug. They're more powerful than anything that your doctor can prescribe with the pad. And remember, as a word of, kind of a final word of caution, if you're in chronic pain, aches and pains, and you are on medication, it's time to figure out why the pain exists, because the medication will only serve to mask your body's alarm system, and over time that medication will take its toll on you.